Hi, I'm Richard Del Rosario, and I hope everybody is doing well and staying safe. First of all, I would like to thank everyone for taking the time to watch my first video proposal on how we can get the PBA started again. Why am I doing this? Well, my only reason is that I just want to help. Of course, I am one with everybody in praying that in a few months, this virus will be contained, country conditions will get better, and the government will allow the PBA to resume under relaxed social gathering requirements that would allow the fans to come and watch the games again. So in this video, we have case studies from leagues from around the world that have resumed play, those that are planning to resume. We also have opinions from medical experts with regards to testing, and we will see how the entertainment industry was able to lobby for the resumption of TV and film production under MECQ and GCQ.
Bundesliga is the latest pro league to resume play. There were no fans. Teams are tested twice a week, with those testing positive separated from the team. Before the pandemic, the average attendance in a Bundesliga game is 40,000 people. This time, they are only allowing 322 total personnel per game. The stadium is divided into 3 zones, and there is a strict timetable limiting the number of people allowed in each zone. There's also hygiene staff on hand to disinfect dressing rooms, and ball boys disinfect balls not in play during the game. As I mentioned, the stadium is divided into 3 zones. Zone 1 is the stadium interior, which includes the playing area or the pitch and its perimeter, the players' tunnel, and dugouts. Zone 2 is the stand section, where the media and control rooms are located. And Zone 3 is the stadium exterior, where the OB van is parked. Here you can see the breakdown of the 322 personnel allowed per game. The home and away format is retained. Host teams are allowed to go home, while visiting teams are restricted to the hotel. Social distancing is observed on the bench, and more importantly, social distancing is observed in goal celebrations. No high five, no hugging. Temperature checks are done before entering the venue. The SBL was able to complete their season and crown a champion. How did they do it? Since most of the bigger venues were controlled by the government, they transferred their games to a smaller venue, which was a training center. The government only allowed less than 100 people for indoor events and 500 for outdoor events. There were no fans. There were daily temperature checks. Hand sanitizers were used during timeouts and after warm-ups, and those non-playing personnel wore masks. Korean baseball also resumed their season. There were temperature checks in stadiums. The umpires and the coaches had to wear masks. No autographs were allowed and high fives with bare hands. No tobacco chewing to prevent spitting. There were no fans, and if a player tests positive, the league stops for 3 weeks. As an added value, the game rights were bought by US sports media and were shown in the USA with American commentators. This brought their league worldwide interest and attention. Now let's talk about leagues that are planning their return and what guidelines they are proposing. CBA President Yao Ming is targeting a July comeback for the league, and he came up with the following proposal in consultation with the head of the National Virus Control Team of China. You will notice similarities in the first proposal I presented to the board. Teams will be isolated in hotels exclusively for the CBA. They will play in only 2 venues, one in the north and one in the south. The players will be tested frequently. There will be a maximum of 50 personnel in the venue per game. Their initial plan was for each team to play 16 games in less than 30 days. There would be back-to-backs and 3 in a row. No fans are allowed, and they are considering 3 options in terms of game format. Number 1 is to play the full schedule. Number 2 is to have a shortened season. And number 3 is to end the regular season and go straight to the playoffs based on the current team standings. In the NBA, there has been continuous communication between the commissioner, the owners, and the NBA Players Association. They are looking to split the teams and play in only 2 venues to limit travel. Venues being considered are Orlando and Las Vegas. Testing will be done frequently, and they are estimating 15,000 test kits will be required to resume and complete the season. If there is a positive case, it would not necessarily entail a suspension of the games. The player will be separated and persisting testing will be done to those who came into contact with him. They have also consulted an infectious disease expert who suggested creating layers of protection such as limiting the personnel for each game, daily temperature checks, isolating participants in clusters or different hotels to make containment easier should a positive case appear. The National Institute of Allergy and Infectious Diseases Director, Dr. Anthony Fauci, gave this opinion on how sports can resume. And I quote, "There's a way of doing that. Nobody comes to the stadium. Put the players in big hotels, wherever you want to play. Keep them very well surveilled. Have them tested every single week. And make sure they don't wind up infecting each other or their family. And just let them play the season out." The NBA also sought the input of a general manager of a hotel that usually hosts NBA teams. And in order to minimize costs and personnel involved in the bubble, he suggested the following concessions: that the rooms will be refreshed weekly and not daily. By doing this, there will be 20% less hotel staff needed. The standard meals will be provided instead of customized meals per player, and that teams will stay in different hotels or separate floors with a dedicated staff. Now let's talk about the Philippine setting and the concerns regarding resumption of play in the PBA. The first main issue is testing. What tests should be done, who should be tested, and how often. Here is Dr. Bingita Padilla, medical team leader of Project ARC, or the Antibody Rapid Test Kits, and one of the health practitioners that is consulted by the IATF in their press briefings. These clips were taken from her virtual interview with the Manila Private Club regarding COVID-19 testing.
Now, is testing important? The answer is yes. Is it necessary for everyone at this point in time to get tested? The answer is it would be nice, but it's not necessary, especially for those who have been in quarantine for the last 2 months and you have remained asymptomatic. It is quite unlikely you have been infected. Now, what are the advantages and disadvantages? The advantages of the RT-PCR is that if the virus is captured in the swab, it is virtually 100% accurate. Okay? It can detect the virus even 2 days before you develop symptoms. As soon as it's there, 2 to 3 days, if the virus is there, you swab them even without symptoms so you can get it early. So this is one of the main advantages. The disadvantages are many things can go wrong along the way, from swabbing, transport in the eyes, to extracting and reading. And the length of time before it's read in the Philippines is also a problem, because to have accurate results, you should read it soon. Ideally within hours of receiving it, or at least 1 or 2 days. But 7 days, 2 weeks, I don't think you can even, there's a degradation of the virus, and you don't get really good results. This is the reality. You know? And it can miss also the virus in 1/3 of cases, even in symptomatics, because of all the factors that go into it. It requires more skilled and accredited laboratories, and you can have false positives and recovered persons. Now, antibody tests, the advantages: easy to use, relatively inexpensive. They can range from 400, at least for Project R, we can get them for as low as 450. I'll show you later the price is 600. No? Quick results. And IgG is a better measure of recovery than RT-PCR in some ways, no? Because sometimes you don't have the virus now, then you do again and you have it again, like Senator Angara. But again, a lot depends on the quality of the kit. I have to keep repeating that because not all kits are the same. No? Again, disadvantages. A lot depends on the sensitivity and specificity of the test kit used. No? It cannot detect the infection before symptoms start. So unlike the PCR, it can. No? If you get the virus, even wala ka pang symptoms, you can detect it. And then IgM starts to rise after 3 to 5 days. It goes higher, and then it goes down after 2 weeks. Now, if you test too early, it might not be there yet. It might be too low to detect. Okay, who should be tested? Okay, you don't have to test everybody. No? Those who are asymptomatic or symptomatic persons who have been in close contact with confirmed COVID-19 persons, okay? In the household, wife, boyfriend, no, etc., girlfriend. Asymptomatic or symptomatic persons who have been in close contact with probable COVID-19 persons. These are patients who have been swabbed but still waiting for results. If you've been in close contact with them, by all means, be tested. All symptomatic persons, the symptoms I described earlier. No? Whether you have been in contact or not, if you show the symptoms of COVID-19, you have to be tested. Okay. Frontliners and essential workers, healthcare workers, those who have service-oriented jobs like hotel workers, waiters, policemen, firefighters, factory workers. It's because we're trying to also revive the economy. And these people will have to be facing people. And of course, high risk. Who are these people? Diabetics, hypertensives, immunosuppressed, those who are post-transplant, who are in immunosuppressives, cancer patients who are taking medicine, those grossly obese with a BMI of 41 or above, elderly and frail, chronic lung disease, renal disease. So all these people are considered high risk, and it would be better to test them.
In my initial proposal, I suggested quarantine facilities for teams in order to minimize the risk of exposure. I understand that this will be a costly endeavor, and following the example of the NBA, I have consulted with a general manager of a leading group of hotels to find out what figure we are looking at. In the Bayanihan We Heal as One Act, the government is authorized to use hotels as quarantine facilities, and on the average, this is what a 4 to 5-star hotel charges. For a minimum booking of 80 rooms, their rate is 4,000 including meals. If we follow the CBA model and get a PBA only hotel, that would mean 150 to 200 rooms that should bring the cost down. At cost, the general manager said they spend around 1,500 to 2,000 pesos a day to maintain a room. There are other alternative quarantine facilities such as condominiums, rented houses, lower class hotels, or even motels. Since there are concerns regarding the quarantine facility idea, I asked another medical expert, Dr. Jose Raul Canlas, if going home after games would negate the purpose of testing. He said this is acceptable as long as there is no exposure at home and people will stay disciplined, considering they now realize the importance of keeping the PBA going because their livelihood depends on it. Film, TV, and other audiovisual shoots are now allowed in areas under MECQ and GCQ. They have presented the relevance of their industry in meetings with frontline agencies such as the NEDA and DTI, and their appeal was finally approved. The Film Development Council of the Philippines have come up with interim guidelines for the resumption of work. Before shoots, there will be social distancing restrictions. A maximum number of people on set must be limited to 50 people. Must provide history of travel within the last 4 weeks, and casting must be done remotely over video conferences or using self-tapes. On the set, a certified nurse must be present at all times. All shoot attendees must undergo temperature checks before entering the set. Anyone exhibiting mild or severe symptoms of COVID-19 is not permitted entry to the set, and a skeletal workforce system must be utilized to limit numbers of cast and crew on set. Liza Dino, chairperson and CEO of FDCP, pointed out, "As we were stuck in our homes with nothing to do, films, series, and television shows accompanied us during these challenging times. They even served as sources of joy, strength, and inspiration." This development gives us hope that we can also appeal our relevance to the appropriate government agencies because professional sports is also entertainment and would give reason for people to stay home, have a sense of normalcy, and uplift public morale.